Hello, my Be Health Empowered family. Welcome back to another episode of Excuse Me, Doctor. I'm your host, Dr. Melissa Clarke, and of course, you can call me Dr. Mel. I am delighted to be back here with you today, and welcome to another amazing week that we are going to create for ourselves. Now, you know, we are here every week, and our purpose is to bring you health topics and bring you the science and the information about them so that you can be confident and empowered when you're making health decisions for yourself, your family, and even your community. So we bring focus to speculation, we clear up misinformation, and we debunk disinformation. So thanks for joining us again, especially the new folks who are tuning in for the first time. If you are watching us on YouTube, please remember to hit subscribe. And if you're watching us on Facebook, please hit that like button. I really appreciate you for doing that. Now, you know, this week we have a really fascinating topic we're going to be talking about tonight. The show was actually inspired by a recap, one of the weekly recap issues that we talked about just last week. And that's that outrageous news that Governor Mike DeWine of Ohio signed into law this bill that allows doctors, hospitals, health insurance carriers to deny services and the payment for those services based on conscience. Now, that basically means that if they have some kind of religious objection or moral objection to providing care for whatever, they can do that. And it's really raised concerns that this new law may deny access to care for significant portions of our country. So the folks who have been raising the most issues about this has been the LGBTQ community. And so it has really inspired us to really try to shine a light on this. And we have two wonderful guests tonight who are going to talk with us about issues regarding access to care for the LGBTQ community. So stay tuned. It's going to be a fantastic discussion. And so remember to share, and share again this episode with any healthcare provider you know who you think might need to tune in and listen to this about being more empathetic or sympathetic. Also, share it with members of the LGBTQIA community or those who love them, because this is a Excuse Me Doctor episode that is not to be missed. So I want to welcome, as always, my co-producers, Mr. Wayne Bruce and Miss Lila Mays. Thanks for joining me.
How are you? Are we on?
Doing great.
Are we on
Doing
here?
Great.
Hang on.
We are here.
My fault. I had muted Lila.
Oh, okay.
Lila wasn't here last week. No, I muted you. Don't worry. You good now. You good. You good.
We got to hear from Lila now.
I mean, because the hat
she is here and in the house.
In the house and in the hat. Y'all look at that hat. It's wonderful.
So we have a lot to talk about this week, y'all, with this weekly recap. Should we just go and get into it?
Yeah, let's get into it.
All right. There we go.
All right. Well, let's start off, as we always do, with the numbers around COVID-19. So we know today we are in a pandemic of the unvaccinated. We know that we're around almost 35 million cases since the beginning of this pandemic, but we are having an upswing of cases in all 50 states, and it's due to the Delta variant that I know you all have heard about, which is now taken over as the dominant variant in the United States. Case rates are doubling from just 2 weeks ago, and it's really like this Delta variant is like the first strain of COVID, but on steroids. And so we're seeing cases increase by 70%. We're around 30,000 new cases a day. And when we talked about this last week, hospitalizations had just started to upswing, but now we're at 36% increase in hospitalizations, and they're happening to people who are unvaccinated. So we're seeing in areas of the country where there are not a lot of vaccines, Texas, Missouri, Wyoming, ICUs are filling up with people in their 20s and 30s. In Mississippi alone, there's 7 children who are hospitalized with COVID in the ICU. And so it's a real situation out there now.
Yeah. It's crazy. And you mentioned the state. I just watched a fight that was in San Antonio Saturday. And when I tell you the place was packed, and I could count on both hands how many masks I saw
Right.
Wow.
in the
Exactly.
space.
Exactly.
So yeah, it's
Wow.
crazy.
So that's really concerning. And, it's leading to more deaths too. I mean,
right.
the death rate is up by 20%, and the people that are unvaccinated are the ones who are accounting for 99% of those deaths.
Wow.
Wow.
Yeah.
So, all right. So what about, let's get into some vax facts then, Dr. Mill.
So
Are people continuing to get the vaccine?
Well, yeah, they are, but at a lower rate. So we're at about 161 million people who are vaccinated. That's about 49.1% of the United States. So still not the majority of the United States yet. We haven't crossed that 50% line. And unfortunately, vaccination rates are slowing down. They've dropped by like 13% just since last week. So that's like not a good direction that we're going in, given the Delta variant has taken over.
Right. And then I know some people are concerned about is it the Guillain-Barré syndrome, or is that exactly what it's called?
Guillain-Barré, close.
Guillain-Barré.
Does look like Guillain-Barré. But it's a nerve condition that sometimes leads to paralysis, which is most times temporary.
Yeah.
And it's often seen, most often, following any kind of viral infection. And so there have been some reports of it following the Johnson & Johnson vaccine, mainly in men over age 50. However, those cases account for less than, get this, 1/1000%, so 0.001% of the more than 12.8 million doses of the Johnson & Johnson vaccine that's been administered. So those handful of cases they've seen about 2 weeks after vaccination. And since this can happen after any viral infection, it's not yet clear that the vaccines are responsible for these handful of cases that have been seen.
Right.
Okay. All right. Listen, we have a tendency to take anything we hear and run with it and say, I'm not
doing
gonna
it.
do it.
I'm not gonna do it.
But what we really need to be taking and running with is the Delta variant, which is over 100 times more contagious than that original COVID. And it can reinfect anybody who had the original COVID strain. And it's making younger people sicker. And it's now this dominant variant, like I mentioned. So what does more infectious mean? Well, it means that you can't get away with what you did last year. You can't wear your mask under your nose. You can't go to bars and restaurants where your masks are down while you're eating or drinking. And you can't hang out with your boys or your girls who are unvaccinated and think that you're not going to get COVID. If you have children who are unvaccinated and you're unvaccinated, you are risking making them sick and leaving them without a parent, or a parent who then gets long COVID and really can't function well as a parent. It means that you got to wear your N95 mask. That's what's actually being recommended now, because the new strain is that much more infectious that they think that just a simple cloth mask is not enough anymore. It means hospitals are filling up and might not have enough space for you if you come in really sick. It really means that the time to wait and see about the vaccine is over.
It's done. It's over. Which leads us right on to what's happening. I'm sorry, Brother Wayne, I'm stepping on your toes, but we're still in some vax facts. So I'm gonna go over to Tennessee. That wants to stop vaccines, not just this one for young people, but a whole bunch of them. Right?
So Yeah, well, it turns out that the Tennessee Department of Health is going to stop all vaccine outreach. So it's not that they're not going to vaccinate.
Outreach.
They're not going to market and promote and remind people to come in for their vaccines if they're teenagers. And this is all due to pressure from Republican state lawmakers who are accusing the Department of Health of circumventing parents and applying pressure to minors to be vaccinated. And this is all in the context of Texas is lagging behind the rest of the nation in regards to immunity from COVID. Only 38% of Tennesseans are vaccinated. So I just mentioned, 49% of the country as a whole is vaccinated. So they're way behind. And the average numbers of new cases are doubling. So in the face of all this, they are backing off on reminding young people to get vaccinated for anything, not just COVID, for anything, for the flu too, and all the other vaccines that teenagers generally get. So it's a real concerning situation in Tennessee.
It could kind of make you mad. It's frustrating.
It pisses me off because it's so politicized and people are out here dying. Y'all thinking y'all gonna have a hot girl, hot boy summer, and case numbers are going up. And then the state says, well, I'm not gonna push any information about getting vaccinated. That really pisses me off.
Yeah.
It's directly responsible for people dying, in my opinion.
And I think the person from the Department of Health was fired in Tennessee.
Yeah, the commissioner of health. Yes, absolutely.
For doing her job. So instead of being like Tennessee, we should be like France. I mean, France is not playing with it. They're not playing with it.
Yeah, France is getting radical, and in the next 2 weeks, in order to enter a bar or a restaurant or get on a flight or a train, you're going to have to show proof of vaccination, a negative COVID test, or show that you've recently recovered from COVID. They're even requiring their healthcare workers within the next month or so to get vaccinated, or else they'll be suspended without pay. And it's working. It looks like about 1 million additional people in France, mainly people under 35, have signed up to get vaccinated as a result of anticipating these new rules coming into play. Currently, their vaccine rate is about 40%, and so it looks like it's going to be going up as a result of this. Now, I don't know how this would play in the United States, but France is getting real serious.
It can play however we wanted to play. I really do. But at some point, people this summer found out if they wanted to travel to another country, they had to have, especially to vacation, either to Hawaii, even in our country, to Hawaii, or to another country like Mexico or Jamaica, by the way, that you had to have proof of a negative test. Well, you didn't have to have proof of vaccination, but you definitely had proof of a negative test. It's all this stuff wrapped up into being overwhelmed. We seem like this crisis has overwhelmed the United States, not only physically but mentally. And so that brings us to what's going on, the things that haven't gone away. The opioid crisis is still going on. And people are still dying from opioids. So, I mean, that brings us to number 4, drug overdose deaths. We're at an all-time high for that.
We are. We didn't hear a lot about the opioid crisis last year. It's almost like it went away, but it was actually simmering and getting worse as a result of all the mental health issues, the isolation, the economic despair, the after effects of COVID-19 that can worsen mental health. All those things were just percolating, and more people were using opioids and unfortunately dying. So we're at an all-time high, 93,000 deaths from opioids in 2020. And, in addition to what everybody else went through, trying to get help for addiction was, more difficult because you couldn't have in-person gatherings like you used to. And then a lot of groups went online, but a lot of people didn't have access to be able to go online for opioid addiction counseling or treatment. So it kind of made the whole thing worse. And a lot of people think, oh well, this opioid crisis is all about white people. Well, no, actually, it's not. Um, Indigenous people and Black people are just behind European Americans in the death rates from opioids. And regardless of what race you are, addiction is a terrible disease. It's a terrible way to die. And if you know anyone who is addicted to opioids, it's really important to encourage them to get treatment. And there are great treatment options aside from methadone, which a lot of people might associate treatment for opioid addiction. There's actually office-based treatment. You can go to your general practitioner if they are certified in prescribing medication-assisted treatment for opioid therapies and be treated. A lot of Black and brown people get pushed towards methadone clinics, but there's another great way, a much better way to get treated for opioid addiction. So it's really important to let people know about that option as well.
Yeah. And condolences to Keisha Cole, who lost her mom, who had struggled with addiction for years.
Right.
Yeah.
Yeah.
Absolutely.
I mean, it's a real thing.
It's a real thing. Industry. I mean, we failed to mention. I see Kirsten Ledford mentioned in our comment Shock G. From Digital Underground.
Yes, absolutely.
Overdose.
Our condolences to his family as well.
His family as well. It's sad.
Damn. It is sad. All right, so we're gonna go to number 5. To our brothers and sisters. This is mostly the sisters, but some brothers that slap love, relax on their head too.
Some brothers that slap some. Hold on, are they like Spike Lee and
Malcolm X?
And Malcolm X.
That's right.
For sure.
That's
brother,
right.
On the.
I mean, there's a whole scene in Autobiography of Malcolm X where he put lye-based relaxer on his hair and had to wash it off in the toilet.
Come on,
I remember that.
toilet. Come on, toilet.
Indeed. I've been there before. Listen, not in the toilet, but where it was burning my whole head. But listen, there was a study that came out recently that indicates that, there's some real health challenges that come along with the lye-based hair relaxers, particularly cancer in Black women.
This is really important. And that's why I wanted to save it to last, because I really want folks, hopefully, to pay attention to this. So there was a 25-year-long study of over 59,000 Black women that show a possible link between lye-based hair relaxers, so specifically lye-based hair relaxers. People who used that product 7 times a year for over 15 years had a 30% increased risk for breast cancer compared to those people who used it infrequently. And it's really important because Black women who get diagnosed with breast cancer are 40% more likely to die from the disease than white women. And so it's really important to identify those contributing factors. So we now know that lye-based hair relaxers may be one of them. One reassuring thing is there's a minimal association between hair relaxers, so with or without lye, and breast cancer risk for moderate users, so people who use less. And we know that more and more Black women in salons have moved away from the lye-based relaxers, and more Black women are going au natural. So I think all those are positive trends, right, Lala?
Yes, indeed. Yes, indeed. Shout out to the Natural Sisters, Dr. Mel and myself, and one of our special guests.
That's right.
No,
and
both of our special guests are natural, but one of them is is a woman.
This brother here doesn't have any lye-based relaxers in his hair either. Come
That's
on
a beautiful thing.
Come on, twist.
That's a beautiful thing.
Come on, sponge. Just saying.
Okay.
I'm going to leave it.
Anyway, moving right along from the recap.
No, but actually, this is funny. That is not funny. Our audience is incredible because one of our audience members says she was a part of that study. And that's
Oh,
Kirsten.
wow.
Kirsten Ledford. I want to give a big shout out to her. Thanks for
Big
being
shout
a
out
part
to
of it.
you. Thank you for being part of that study.
Yeah.
Wow.
Yeah, there we go. And so you
All
know
right.
what time it is, folks. It is
Indeed.
What
time
time is
for
that?
the
weekly debunk. Stopping misinformation in its tracks.
Well, so this week, Twitter Tanisha says, I don't know why I should get vaccinated because I heard once my vaccine fights off COVID for the first time, it can't fight off COVID anymore.
I don't know about that. Excuse me, Doctor Mel. Is that true?
That is not true. There is a concern that I'm hearing here from that audience member that once the vaccine fights off one variant, that it'll lose its effectiveness. But immunity doesn't work like that. As a matter of fact, immunity is more like a muscle. The more you use it, the stronger it gets. So the vaccine stimulates your body in a couple of ways. First, it stimulates it to make antibodies. Those antibodies do eventually wear off in a few months, probably 6 months or more. But it also creates a reservoir of cells that are capable of producing antibodies in the future. So every time they get the message that you are being exposed to COVID, they just pump out more antibodies. And that kind of immunity, called cellular immunity, can last for years. And the more that the body is stimulated to do that, the more it is able to continue to do that. So no, it is absolutely not true. The more you get exposed once you've been vaccinated, the stronger your immunity gets.
All right.
All right.
And there you have it. I mean,
All right.
there you have
So
it.
that is the debunk for this week. I want to thank my producers for joining me for this segment. Any last words before we head off to our next segment?
Last words
Click
should
like,
be,
click share.
that's it. Click like, click share. We're about to get into it. This
All
is going to
right
be a
now.
great discussion. So I'll bid you adieu for now.
All right. We'll see y'all in a little bit. And
Okay.
so, just like I said at the beginning of the show, we have a fantastic discussion. So, July 1st, that was when the Ohio governor signed the bill allowing the hospitals and the doctors and insurance companies to avoid caring for people based upon their conscience. It didn't specifically call out any particular community, but laws of this type prior to 2019 were really giving medical providers who did not want to provide abortions or medically assisted suicide a way to not do that. But after 2019, the federal administration under Trump extended this conscience clause to other medical issues. And as you can imagine, this can be a slippery slope because someone's conscience, quote unquote, can include denying services based upon gender, sexual orientation, racial, religious difference, and it's absolutely outrageous. So, we're going to talk about this tonight from the perspective of the community who's been the most vocal and in raising concerns about this issue, and that's the LGBTQIA community. And they already face many barriers to care as well as health disparities that result from that. And this kind of law can worsen that. So I am really honored to welcome two fantastic guests to guide us through this discussion. The first is Dr. Edith Biggers. She is a public health and staff physician in the HIV clinic at the Fulton County Department of Health and Wellness, and that's in Georgia, where she provides compassionate and state-of-the-art medical care to underserved patients with an emphasis on maximizing their empowerment through education. She's also secretary for the social justice organization ZAMI NOBLA, and NOBLA stands for the National Organization of Black Lesbians on Aging, which is committed to building a base of power for Black lesbians over the age of 40 and advancing women's rights and the rights of the LGBTQIA community. So welcome, Dr. Biggers. Thanks so much for being with us.
Thank you. Thank you, Dr. Mill.
Absolutely. And then next, we have Daniel J. He is a blogger, singer, dancer, actor, and social media influencer. He hosts the show The J Spot, which is an online publication and talk show. But he's also an advocate with APLA Health, where he advocates on social justice issues such as health disparities of concern to the LGBTQIA community. Welcome, Daniel. Thanks so much for joining us.
Thank you for having me, Dr. Mel.
All right. I am so glad you all are here with us. And, we're going to get right into it. I'm going to start with Daniel. And just to level set, for those who don't know, can you explain what the letters of LGBTQIA stand for?
Sure. So I know that it's a long acronym. It has gotten longer over the years, and it can get a little confusing with the elementary of it all. But the L stands for lesbian, G is for gay identified individuals, B obviously is for bisexual. The Q has changed over the years. In the very beginning, the Q stood for questioning. Those who weren't sure where they stood on the spectrum of sexuality. In recent years, younger generations have coined it to be to stand for queer, which is kind of an umbrella term for whatever your orientation or identity is. And then, of course, we have the T, which is for our transgender individuals, both transmasculine, transfeminine, and non-binary folks. The I is for intersex. It is what we now refer to as folks who we used to say were hermaphrodites, those who were born with a combination of genitalia, but not having one genitalia all the way to one gender. So that's the intersex portion of it. And then we have A, which is for asexual. And asexual is more so of it's considered an orientation, but it's for people who are not sexually attracted based on genitalia or gender. It is an asexual person doesn't have the desire necessarily to have sexual relations at all. A lot of their connection is really based on personality and emotional connection versus sexual connection.
Great. Thank you so much. I've also heard that the A stands for ally, too, of which
It
I
can
would count
stand for
myself as
ally,
one.
absolutely. It can stand for the ally, absolutely.
Right.
So I think it's clear from that description that you gave that although all these letters are lumped together and they represent individuals who have very different issues potentially, what are some of the challenges accessing healthcare that you have encountered or heard from those from whom you advocate, even though their particular health issues might be different?
I think one of the major things that I've experienced personally and that I've witnessed is that when people think about the LGBTQIA community, like a lot of marginalized communities, we're thought about in a monolith, like it's just all one thing, it's one group, and we have one issue. And what that does is it stops medical providers and the medical field of health and wellness. It stops that field from actually understanding that we are not all the same.
Mhm.
We need very different things for our body. And it also, the disparaging part comes into play because depending on your expression, gender expression, how you navigate your orientation, some people can be stealth. They can hide the fact that they're gay. They can hide the fact that they're a lesbian if they don't look like the stereotypical image of what those things have been, taught to us or pushed to us through media. One of the biggest disparities definitely happens with our trans individuals when it comes to hormone replacement therapy or gender reassignment surgery. And that has been an uphill battle for a very long time, more so now that the trans community is more upfront and vocal about their right to healthcare.
Right. No, that makes perfect sense. And so I'm going to transition to Dr. Biggers. So you're a physician who cares for individuals with HIV and other health concerns. What was your reaction when you heard about this new bill that I was talking about that's passed in Ohio? What concerns do you think that it presents?
I was appalled. I think it's morally reprehensible. I think that it's really hard enough. The LGBTQ community is already stigmatized. And I have seen that, in my years of providing HIV care primarily to Black men who have sex with men, just the fact that how stigma and how marginalization prevents people from coming in to access care. And so now you have signed into law, Governor DeWine has signed into law that doctors can go with their conscience. So if their conscience is, oh, I don't have to provide care to someone who is different from me, someone whose gender identity I don't agree with, I don't have to do it. And not only don't I have to do it, but I don't have to be called into question.
Right.
I think part of the rest of that is that they cannot be legally tried or sued, is my understanding. And insurance companies also have the right not to cover the medical needs of LGBTQ individuals. And again, I have worked with people who are not insured my whole career. That is my mantra. That is my specialty. And just trying to get services for people who are uninsured is difficult in and of itself without
Right.
that being a law, without that being legal. So it's
Right.
morally reprehensible.
Yes, absolutely. And some of those barriers include geography, in terms of qualified providers being in your community, transportation, childcare, just being able to get to your appointments, hours being ones that people who work one or two jobs can be able to get to in the evenings or weekends. I mean, there's a whole host of them we know. To add this on top of it, I agree, in a profession where we take an oath to do no harm,
Right.
what kind of harm might be done by putting this into place? Daniel, what do you think?
I think there's a lot of harm in regards to what a person within the LGBTQIA community is willing to do to get the care that they need when it's not offered to them in a professional setting. I.e., you have a lot of trans individuals who depend on hormone replacement therapy. And if they're not able to get hormone replacement therapy, if their insurance is not going to cover it, and they're not able to get it in the consistency that they needed, in the doses that they needed, they'll get it from somewhere. And the
Mhm.
problem with that is that a prescription of HRT dosage for one trans individual can differ based on that person's body. So if
Right.
I
And just to
am
be
not
clear, HRT stands for hormone replacement therapy.
replacement therapy, yes.
Yeah. Mhm.
And
Right.
so if I'm someone who needs a particular dose and a particular type of hormone, and I can't get that from my medical provider, and I know that you have it, but it's a completely different dose, and I take that, that could harm my body,
Right.
Yeah.
but I'm willing to do it because I'm trying to live a truth. I'm trying to do what I need to do to make sure that my body is representative of who I am and how I live my life. And we also have to look at the damaging effect of, when I live in LA, in a metropolitan city where we have hundreds of hospitals, hundreds of clinics. But when you get into more rural spaces, rural states,
Yeah.
that there might be only one hospital in a 50-mile radius.
Mhm.
So the damage that can be done is monumental when you think about what a person is willing to do to get what they are not given as a right when it comes to healthcare.
Right. And I
And
think that No, go
may,
ahead, Dr.
may I
Biggers,
add something to that? Um,
please.
I have many trans patients, many trans women patients who, to a one, have said to me in no uncertain terms that their hormone replacement therapy is even more important than their antiretroviral therapies. Now, we know that with HIV, the impetus is on taking your medication, getting your viral load down to undetectable. So if you have someone saying to you that if I don't get this treatment that is very important to me, that I'm not going to take my antiretrovirals, that in and of itself is another layer of
Mhm.
doing harm to a patient.
Absolutely. That is so critical. And you mentioned that, you are in LA. Daniel and Dr. Biggers, you're in Georgia. This law happened in Ohio. We know that some states, very few people report or self-identify as LGBTQ. I think it's like 2% in South Dakota, and the high is about almost 9% in DC. In places where there's a low identification of individuals, do you think that that's also going to present more issues in those particular areas as well?
Yeah,
Absolutely.
absolutely.
Yeah.
Absolutely.
Yeah.
Because again, you have to get into the mindset of a person who is trying to look in the mirror and see the person that's representative of how they feel and how they identify, at the end of the day. And to me, um, I get asked often, Dan, you talk about transness so much, because to me, this particular bill, even though it's not specific to transness, it's indirectly, covertly an attack on transness. Because let's be honest, if I'm a gay man, I can put on a suit, I can butch it up. If I'm a feminine gay man, I can butch it up and go in and get whatever medical treatment I need, and you never know that I'm gay. So if I need my colon checked, if I need a prostate exam, if I need my regular physical, I can get all of that done. All I have to do is play the part. But when it comes to things like PrEP, which is a system for those who are HIV negative to remain HIV negative, if I want to get a PrEP prescription, or if I want to get hormone replacement therapy as a trans individual, or if I want to get gender reassignment surgery, these are procedures that are in the face of the doctor knowing, oh, you want something that goes against what I personally believe. And
Right.
so when we read these laws and when we read, what has been signed off on, we have to look at the underlying layers that lie there. This is not about, just a regular gay man or a lesbian woman who dresses masculine or dresses feminine. They're really putting into place a system as an attack on the trans experience as a whole. And they wrap it in a pretty package where it's lumped in to other things.
Right.
Because even if we talk about religion, looking at me, you don't know what I believe. You don't know if I'm Muslim or if I'm Christian or if I'm a Buddhist or, if I'm a Wiccan or whatever the case may be. And so in those areas, we can move in a very stealthy way. Trans individuals don't always have that ability. They don't have that
Right.
privilege.
That's that's true. And I think one of the things that is really important to recognize is, even though the trans community is most likely the community that this bill was intended to uh, uh, penalize, let's say, that just as you brought up those other groups of people, it could eventually be a slippery slope to affect other people. So, for example, a 21-year-old woman who wants birth control but who's not married. Maybe
Exactly.
that's against some providers' belief to provide them birth control. I mean, the 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 cases where this could apply are really concerning, and that's one reason why I think that everybody, even though it might seem to apply mainly to the trans community, everybody should be concerned about it, because it can potentially, if you are not a part of the quote unquote majority culture, it might affect you in some way, shape, or form.
And we also
Especially, and
need
I
to
will,
look at
oh, go ahead, Dr. Biggers.
the hypocrisy of Governor DeWine also says, oh, well, this is not going to hurt anybody because, oh, well, if you go to your doctor and your doctor feels this way, then go to somebody else. Well, that is not the answer. That is certainly not the answer. Um, when you look at the numbers, well, in the HIV community, there are very few of us in Atlanta. As large as Atlanta is, we are really in the minority. Those of us who take care of people living with HIV. It's not everybody. And
Right.
so it's not as simple as, okay, and especially in a small town. So this person cannot meet your needs. So you don't have anybody else to go to.
Right. So And also there's issues of who takes your insurance too. Let's not forget about that. That's a huge barrier. So, we need to go to questions, but before we go to questions, I would love to hear from each of you briefly. What are some of the answers to improving access to care for the LGBTQ community and addressing some of the higher rates of illness that we might see in that community? Because, a lot of people think about, oh, HIV is something that gay men get, but you know what? Um, just as everyone else gets heart disease, high blood pressure, diabetes, depression, so do members of the LGBTQIA community, and sometimes at higher rates. So, what would you say are some of the solutions that you've seen work in terms of improving access to care?
Dr. Biggers, you want to go first?
I was going to ask you the same thing. All right.
Well, I can go first. It's for me. It's two things. Number one is education. You have to know what resources are available to you in your city, your state, your region. A lot of times there are a lot of programs, state programs, local programs, county programs, city programs that will assist you with your medical needs, especially if you are within the LGBTQIA community. However, if you are not in affluent areas, that information may not be disseminated equally. So it really is about doing some research and figuring out what programs are available to you and then helping the community know where those resources are. The second thing is if you are in a rural area where those type of programs don't exist, you have got to organize. You have got to get your community together, no matter how big or small it is. And you have to start somewhere and really advocate, writing letters to your senators, your Congress,
Right.
writing letters to your local elected officials to advocate for these type of programs to happen and to be birthed in those regions. Because the sad part about it is if you're in middle America, you just may not have it. Like Dr. Becker said
Right.
earlier, it just may not be there. And
Hmm.
so it takes that organization and that community effort to really build that and birth that from the ground up.
And
Dr. Biggers?
self-empowerment. I spend a lot of time with my patients helping them to understand something about the importance of self-empowerment, being their own advocate, how to do that, and the importance of it. Not to ask questions, not just to sit there and just take everything I say as the gospel. Ask me some questions. I even tell them what questions they should be asking me. And then take that knowledge and, just as Daniel just said, go out and advocate. We have to advocate. We have to resist. We cannot accept any of this just lying down. Not at all. I was pleasantly surprised earlier. I was looking up the Hippocratic Oath and I saw, I think it was the University of Pennsylvania medical school, the incoming class was writing their own take on the Hippocratic Oath. And not only did they talk about do no harm, but they talked about social determinants of health and how
Right.
important those are to, that doctors should be in the forefront of leading that fight. We
Yes.
so it I mean that was just incredible. So we have a new breed coming along, fortunately,
That's
but we all have got to be that. We all have got
that's
to stand up.
Yes, that's wonderful. Well, thank you for bringing that up. I am going to bring back my wonderful co-producers, Lila and Wayne. Um, I don't know if y'all have some questions for us from the audience.
A couple of questions. This one I'm gonna ask to Dr. Biggers first, and then Daniel, please piggyback if you have anything. But particularly about COVID, how has it impacted Dr. Biggers' lesbians, and then the larger LGBTQIA community as a whole?
Sure, sure. That's a good question. So let's see, I can answer that on a couple of levels. One thing, Zami
Okay.
Nova, the group that I am the secretary of, we are all about self empowerment for aging Black lesbians over 40, especially over 40. And one thing that we did, our founder, Marianne Adams, is just passionate about building community, however that may be. So we have done so many things on Zoom during this pandemic. We have a board of women throughout the country and we have our board meetings on Zoom. But for the larger community, we have all sorts of educational programs, financial educational programs. We have a ukulele club that we do on Zoom, a book club on Zoom. Just and we talk about the importance of vaccines and masking and risk reduction and risk assessment during this pandemic. And that's an ongoing conversation. We're also doing research, community based research on COVID-19, and we're doing focus groups as well as questionnaires that will be given to 300 lesbians, 100 black lesbians, 100 lesbians of color, 100 white lesbians, to really do some community based research and see how COVID-19 has affected all of us.
Okay.
But we're not a monolith. Like Daniel
Right.
said at the beginning, we're not monolithic at all.
Okay. All right.
In my experience, the effect of COVID as it pertains to the larger LGBTQIA community is the majority of them don't have time to think about COVID. The majority of them are struggling with trying to get HIV care. The majority of them are fighting an extreme case of homelessness and displacement. So they're
Wow.
trying to fight every day, figure out where they're going to lay their head, where they're going to get their
Just to
next meal,
survive.
and
Wow.
things of that. As we talk about the social determinants of health. So to add COVID to the mix, although it is a national, global issue, for a lot of LGBTQIA folks, specifically our younger 18 to 25 demographic who are persons of color, it's just not on their radar. They're trying to survive life in other ways. And so with
Wow.
APLA, we have
Wow.
programs that try to advocate and educate and provide the service for them to get tested, and we help them with those social determinants, in addition to trying to get them vaccinated and get them the care that they need. But, when you're homeless and you're hungry, going to stand in a line to get a shot for COVID, this disease that I probably don't even have all the right information for, that's not on the
Right.
top of my priority list.
Wow.
Okay.
Excellent points.
Interesting.
Yeah.
That's great points. So
I have another. Oh, go ahead, Wayne.
go ahead.
I was going to say I have another two-parter.
Go ahead with the two-parter. I'll get my question in one point at a time.
Okay.
I'm going to sit back and push buttons.
Yeah. Thank you. Somebody's got to do it. I'm gonna I'm gonna start with you, Daniel. Here's the two-parter. Can you break down cisgender for us? A. B. How can heterosexual cisgendered folk be the best allies possible in terms of healthcare and period?
Okay.
For both of you,
The
but I'm
easiest.
starting with Daniel, Dr. Biggers.
Okay. Cisgender simply means the cis portion of that just means that the sex that you were assigned at birth is also the sex that you agree with and is the way that you live your life. For example, I was assigned a male at birth. I identify as a male in my life, regardless of this lipstick and this beat mug. I still identify as a man. And so that is what the cis portion means. It means that I agree and identify with the sex that I was assigned at birth, whereas trans obviously is I do not agree or identify
Right.
with the sex that I was assigned at birth. And then the second part of that question, just one more time.
Allies,
How can you be a good ally?
cisgendered allies.
I'm going to say this specifically to my Black community,
Mm-hmm.
because we're really bad at this.
Mm-hmm.
We have got to understand the importance of the intersectionality between being Black and being part of the LGBTQIA community. A lot of cisgender heterosexual folks, specifically within the Black community, sound like racist, white supremacist, privileged white folks when they start to talk about the LGBTQIA intersectionality. And
Right.
so if you are going to be a good or even a great ally, it starts with listening, putting your biases aside, understanding that you don't have to agree in order to give help. And lastly, understanding that just because there may be a commonality somewhere in gender identity or even in racial and ethnic identity, the intersectionality of being black and brown and LGBTQIA is not something that people can separate. I am black and gay at the exact same time. And
Right.
I have to struggle with every single one of those layers at the exact same time. I don't get to choose which part of those layers I fight for. And so, as a cis heterosexual ally, it's important to understand that. Just like a white person has to understand, I might not know what it is to be black, but I can sit, I can listen, and then I can learn where I can be the most help and use my privilege when appropriate to advocate for that marginalized community.
Right.
Okay.
Dr.
Daniel, I
Beggars?
couldn't have said it better. That was just perfect. When I'm at work, I find myself fighting all the time. When a trans woman comes in, how many times do I have to say, the person says to me, your patient is here, and he does, and I say she. And then, well, can you call him? And I say her. And so educate yourself. Educate yourself. Understand that how a person presents is how you address that person. It's as simple as that. Then people always want to fight with me. Oh, well, I don't understand. I don't understand this. You don't have to understand anything to be respectful.
Right.
And,
Well,
and I
Yeah.
say that to people all day long. There are plenty of things that I don't understand in life, but I don't have to be disrespectful.
Right.
wow.
Excellent
And if you
point.
don't know, ask.
And
That is
Yes.
something.
Right.
Don't assume. What are your
Okay.
Yeah.
pronouns? How do you want to be addressed?
And
Okay.
and I like just simply judge not lest ye be judged.
Okay.
For my Christian Bible reading brothers and sisters out there, it definitely clearly says that.
Okay.
Wayne.
I guess I got the next 3 or 4 questions, Lila. So look, we have a few questions, and we're in the lightning round. We're gearing down, but uh,
Okay.
all great, just great answers on everything, guys, and ladies and men, and I'm not getting into it,
Y'all, folks,
y'all,
y'all.
Folks,
because
folks.
I can't say what I want to say online. Anyway, uh, so we got a question, much more of a statement from Shawan McGee. And Shawan says, it's much harder to advocate for yourself in rural areas. Can you just discuss that briefly?
Absolutely. Absolutely. I would agree. I would agree. I can't tell you the number of my patients who come from other places, from small towns. And I asked them, just out of curiosity, what brought you to Atlanta? And they can't get what they need in their town, or everybody knows them, and they would not be accepted for who they are. So yes, it is more difficult to advocate for yourself in a small town. Absolutely. Which is not to say that you shouldn't do it, because you absolutely have to. You absolutely have to find a way to do it.
Okay.
But
It's
it is
definitely
more
difficult.
difficult.
It's definitely difficult, but not impossible. And, thank goodness for the advancement of technology where you can
Right.
advocate for yourself virtually. And if you
Yeah.
are in a rural area where you can't find a community physically, you can find one virtually, absolutely, that will help get on board and fight for you and your community, even if they live somewhere else. Because it don't take nothing to virtually sign a petition.
Right.
Okay.
And even telehealth services now are available in
Absolutely.
rural health, that can link to doctors in other areas.
Okay. Our next question is from one of our favorite people, uh, Mateo Levine Ledesma. Our community is strongly faith based, yet there appears to be an anti LGBT barrier coming from some of our churches. This appears to lead to more health disparities. Thoughts on how to address these barriers?
As a licensed minister, I know shock because I cuss on my social media. Um, Focus on the business that pays you is my advice when it comes to faith based. If you don't agree with sleeping with a gay man, don't sleep with one. But that shouldn't stop you. That shouldn't stop you from loving on someone. And the Bible says, when you do for the least of these, it's as though you do for me. And there's no way that you can do for the least of these. You can't consider yourself the least of these and then not address the fact that you have privilege for people who are lesser than you or who are treated lesser than you. So just love on people and do for the less of these and let God do what God does in the judgment area because that ain't your business either.
All right now.
And there you have it.
Daniel J, ladies and gentlemen.
And there you have it.
Ed can sing heaven down too. I'm
And the
going to
good
say
Reverend
that.
Doctor has spoken.
Listen,
The good Reverend Doctor has spoken. We have another question from coming in from Max Gregory Anderson. How can the face of the Black, brown, LGBTQ community become more prominent in the public and their voice be represented? Okay. Somebody.
Dr.
You
Biggers?
want to take that?
That is just not a 1 minute answer.
Okay. Do the best you can. I'm sorry.
Best I can. I think that we have to be out there. If there is an opportunity to be out there, we have to be out there. And sometimes it's about one person being the face of, say, HIV, since that's what I know and love. I have several of my patients are willing to be the face of HIV, to represent, and I encourage them to do it and to bring as many people with them as possible. But that's difficult. That's difficult for a lot of people.
mm-hmm.
Thank goodness
Right.
we have social media, because that is made easier, certainly, I think.
Right.
I'm
And
just going to say quickly. Oh, I'm sorry.
no. Go
Dr.
ahead,
Gunn.
Daniel.
I was just going to say quickly, we have to understand that historical trauma is real within the Black and brown community. And like many other things, white folks stole, yet again, the narrative for the Black and brown LGBTQI community because it was Black and brown trans folks who started the movement. And so
Right.
one of the things that we need to do to be more presenting or be more represented is to understand that LGBTQIA is not a white thing, which is why it is so hard for the Black and brown community to accept the intersectionality between being Black and brown and part of the LGBTQIA community, because of the historical trauma that we've been taught and indoctrinated, that when we think LGBTQIA, usually the image that pops up in most of our brains is a gay white man.
Right. And I think that's where the question came from. How can we change that narrative? I mean, I think from a political standpoint, correct me if I'm wrong, the first openly gay Black congressman was elected from New York this past time in the last year or so. And I think that's one way to continue to advance the agenda is on the political sphere as well. So I just want to throw my answer out there to Max Gregory Anderson as well.
So we are over time right now, but since if it's okay with Lila, because she is a stickler for time, we could go. Can we go over a little bit, Lila?
60 seconds.
60
You have
seconds.
one last question. Love y'all so much.
Look, one last question. Another one from Shawan McGee, and it's important. I'm a straight female, but my daughter is trans and I support her fully. However, he doesn't open up even though I'm there every step of the way. Is it possible to support in silence? Last question.
Great question.
Absolutely.
No. That's my answer.
That was a 60-second answer. Yeah.
Yep.
All right.
Okay. And there you have it. Dr. Biggers?
I'm going to pass on that one.
Okay.
Okay.
And there you have
All right. Well, I mean, I think, thank you for all those wonderful questions to my audience. Thank you to our guests who have guided us through so many topics that we've touched on. I think one of the huge points, though, that we've made and we've heard tonight is the LGBTQIA community is not a monolith. That stigma and discrimination do affect them, and the access to care. That we need to be allies. We can't be allies in silence. And there's so many issues that also might of social determinants of health that affect that community, that makes it difficult to access care. Even think about COVID. But being advocates and really putting the issues out in front, seeking community and getting educated about options that are open to you for your care is really important, and that laws that allow discrimination of any kind need to be fought and fought vigorously. So I just want to thank you guys for being with us tonight. Thank you to my wonderful co-producers as always. I hope to see everyone next week. We're here every Monday night, 9 p.m. Eastern, 6 p.m. Pacific. You can check me out tomorrow morning on the Russ Parr Morning Show. I am the medical contributor to that show, and I'll be on at 7:48 a.m. East Coast time if you're awake. And until I see you, wherever that is, always remember, be wise, be well, and be health empowered. Thanks so much for joining us.